UK healthcare system is broken. Worst country in the world to get injured in.
A Canadian man recently voiced his frustration with the UK's National Health Service, NHS, after experiencing what he described as excessive waiting times in an accident and emergency A&E department. In a video recorded inside what appears to be an NHS hospital, the man with his arm in a sling and claiming to have suffered a broken bone criticised the country's healthcare system, calling it broken and asserting that the UK is the worst place to get injured. His remarks, likely fueled by prolonged delays in receiving treatment, reflect a growing sentiment among patients as A&E services face unprecedented strain. The NHS is currently grappling with a severe crisis in emergency care, marked by record-long wait times, severe staff shortages, and overcrowded facilities that medical professionals warn are compromising patient safety. According to the latest NHS England data from March 2024, only 57% of patients in major A&E units were seen within the 4-hour target window, a stark drop from pre-pandemic levels and far below the 95% benchmark set by the government. Disturbing reports from healthcare workers and patients reveal scenes of individuals waiting more than 24 hours for treatment, often in hospital corridors or makeshift spaces due to a critical lack of available beds. One NHS consultant, speaking on condition of anonymity, described working conditions as resembling third-world medicine, with staff forced to assess patients in storage rooms and other non-clinical areas. Ambulance services are also under extreme pressure, with 1 in 5 vehicles delayed for over an hour when transferring patients to A and E, well beyond the recommended 15-minute threshold. Paramedics have reported being stuck in queues for entire shifts, unable to respond to urgent calls, further exacerbating delays in emergency care. The root causes of this breakdown are multifaceted, including a loss of over 13,000 NHS beds since 2010, a collapsing primary care system that has pushed more patients toward A&E as a last resort, and widespread burnout among healthcare workers, with 1 in 3 nurses considering leaving the profession due to unsustainable workloads. Additionally, an aging population with increasingly complex medical needs has placed additional strain on already overwhelmed services. While the government has announced measures such as £1 billion in emergency funding and plans to add 5,000 new hospital beds, healthcare leaders argue these steps are insufficient to address the scale of the crisis. The NHS recovery plan aims to rebuild capacity over time, but experts caution that restoring acceptable performance levels could take years. Meanwhile, patients continue to bear the consequences, with harrowing accounts of elderly individuals waiting half a day or more for critical treatment. The Royal College of Emergency Medicine estimates that delays in emergency care may contribute to as many as 14,000 excess deaths annually. Without significant and immediate intervention, the situation is expected to deteriorate further, leaving both patients and healthcare professionals in an increasingly untenable position.